So coming to the section in which we detect varices through different types of investigation techniques. So the foremost and the most common way to detect a esophageal varices is the upper GI endoscopy. So it is the most common method to see if a patient comes up into the emergency or the OPD with symptoms such as hematemesis, he's bleeding through his mouth, and the most important step is to first of all hemodynamically stable the patient and then take him up for an endoscopy to see where is the lesion and what is the reason why the patient is having hematemesis. So upper GI endoscopy is usually done and it's very preferred in patients who present with ascites and hematemesis, and there is a consensus done which shows that every patient with cirrhosis, they should undergo endoscopy to see if there is a presence of esophageal varices. So if we look at the first diagram, as the arrow shows that they are dilated arteries within the esophagus, as this is the endoscopic picture showing the esophagus, and it shows the dilated arterial straight lines. And then in the second picture, we can see that it is a more worsened sort of a picture of esophageal varices, and there are large esophageal varices, which is almost more than approximately 5 millimeter. And there is also a presence of a fibrin plug, which shows that there could have been bleeding from these large esophageal varices. And then the second technique is the CT scan. CT scan usually helps in finding out cirrhosis and then finding out any ascites, portal hypertension, any of the splenomegaly or collateral vessels within the abdomen. So these are different images of the CT scan. As in the first image, we can see that this is the liver, which is which isn't very formed, and it is showing that there is a difference in the contour of the liver. And then we can see that there's a picture of the spleen, and it shows as comparison to the liver that it's very hypo-intense. And then in the second picture, we can see that there is the presence of, this is the coronal section of the CT scan, and it shows contrast enhanced esophageal varices within the esophagus. And then in the third picture, we can see that there are two esophageal varices, approximately 5 millimeter and 6 millimeter each, and they are completely opposite to each other within the esophagus. And then in the last picture, we can see that there are tufts of gastroesophageal collaterals, and it is also showing an enlarged spleen on the right side. And then lastly, the way to measure, to diagnose a patient with esophageal varices is the endoscopic ultrasound, which is very, very useful in some cases. As you can see, this is also an endoscopic picture, but we can also have an ultrasound sort of a picture of the esophagus and ultimately showing esophageal varices. And this is the endoscopic picture. So it's a combination of the endoscopy and the ultrasound done. It usually uses an echo machine, and these probes are usually very mini in size. It helps in, it's very useful in seeing the different aspects of the esophageal varices, and ultimately it's also helpful with the treatment of esophageal varices, as through the endoscopy we can also treat the patient with sclerotherapy or giving him any of the glue injections that are necessary.